Good morning, everyone, and welcome to the webinar. Today we are joined by Scott Bredmour for Aetna and Leslie Eisler from Humana to discuss their 2021 products. We're going to start with Aetna at 9 a.m. and then we'll move on to Humana at 10 a.m. with a 5-minute break in between both presentations. I'm going to start with a little housekeeping. Your phones will be muted throughout the webinar. If you have questions, you can type it into the question box. We will have a short Q&A at the end of the presentation. If you don't already know, my name is Nelson Culp, and I'm the Director of Employee Benefits at Cornerstone. I'm joined by my colleague, Shelley Brownell, the Senior Director of Employee Benefits, who will be taking over for the Humana presentation later. Our information is right there on the screen if you would like to contact us. Also, give us a follow on social media. We post industry and Cornerstone updates and information. Go to Facebook, LinkedIn, Twitter, or YouTube to give us a follow. As we inch closer to the fourth quarter, I would like to highlight some of Cornerstone's added value programs that we have exclusive access to as a Cornerstone broker. Autopilot is a compensation-based client referral program that is perfect for managing client overflow during the enrollment season or any time throughout the year, especially when it falls out of your business scope. With Autopilot, our talented team takes care of your clients' health insurance needs for individual and family coverage, employee benefits, or Medicare solutions. Contact us for more information. Cornerstone's succession planning program helps you arrange a strategy to provide your beneficiaries with income along with a peace of mind in the event of your unexpected death or disability. This includes drafting communications to your client base in the event of your death or disability, preparing your business and beneficiaries with a financial plan, conducting annual reviews to audit your succession plan, and make any necessary changes. Contact us for more information. And now, without further ado, let me introduce Scott Bredmour from Aetna. Scott, it's all yours.
Thank you, Nelson. Yeah, so I did want to start. So once again, I'm Scott Bredmour with Aetna, and thank you for joining us today. The product I'm going to be speaking about, it's called Aetna Funding Advantage, where in Ohio, this is our 2 to 100 product. In Kentucky, it's going to be 5 enrolled to 100. And since we do have everyone from all over the state of Ohio, I had to touch on the newest deal we have in the market, and that is with the Cleveland Clinic. The Cleveland Clinic and Aetna have teamed up to create a ACO, which is an accountable care organization. And there's going to be a lot of information coming out on this. Cornerstone is going to be a great resource for you. But just the easiest way to think about it is the Cleveland Clinic. They have over 10,000 providers. It's the product's offered in 10 counties, and then there's also going to be a 10% concession. With Aetna Funding Advantage, some of the great benefits of the product is you can have up to 4 different plan elections. So the clinic deal or the clinic network is going to be a wonderful dual, triple option for your customers. I love to start with this slide right here, and really why I like doing this is Aetna Funding Advantage is a level funded product, and we are actually the largest level funded product in the nation. It's great. It makes it easy for us, it makes it easy for you. In about 40 different states, it's the same national network, the same product. They all have the same benefits. So if you ever have that one customer in Kentucky or Michigan or West Virginia or Pennsylvania, they are always going to be Aetna Funding Advantage if it's below 50. In the green states here, you'll see that it goes up to 100. And I think there's going to be some really phenomenal benefits that we're going to go over today for especially that 51 to 99 segment. The purple states go up to 50. The really only state that you got to think about is Indiana. The Department of Insurance has not allowed us to expand this product in Indiana as of yet, but I'm sure that's soon to come. But really, Michigan, Ohio, Kentucky, West Virginia, PA, Illinois, it's all going to be the same product that we're going to go over with all the additional benefits. So why Aetna Funding Advantage? And really, everyone knows who the competitors are in the market, right? We're competing against a few other level funded carriers, the MEWAs and grandmothered and grandfathered business. When you're especially looking at the MEWAs or grandmothered, grandfathered, 42% of Aetna's book of business on Aetna Funding Advantage is getting a surplus today, right? So typically, if the price is the exact same, just the fact that they have a 42% chance of getting money back should be enough. In my opinion, the best part of the product comes with the transparency. The reporting we're going to go through today for a 20 enrolled case, I guarantee you've never seen anything like it for someone that's not truly self-funded. And then all the value adds. These are going to be, what does the member get? What do you talk about during open enrollment? More than just, hey, we're switching carriers. You're getting a new ID card, and make sure you log into that member portal. This is just a MEWA summary in general. It's not specific to any other carrier. This is just MEWAs across the country here. But really, what's the major difference? Well, in a MEWA, you get no reporting. You get no chance at surplus. You typically can't have 4 different plan designs. There's chamber fees. There's membership fees. We have none of that with Aetna Funding Advantage. Of course, we have a national network, an ID card, all that typical stuff. But we also have an Apple Watch program. We do deductible and out-of-pocket credits, which is really going to be important for this 10/1, 11/1, and 12/1 effective date. We have a program called PeerFit, where we will pay for up to 10 wellness classes a month. They get 20% off of all CVS brand goods, health brand goods in store. There's going to be a really neat theme of this product, Aetna in general, is we are now the same company or under the same umbrella as CVS and Caremark. So overnight, we became the largest PBM in the country, the largest retail pharmacy in the country with over 10,000 locations nationally. We have $0 CVS Minute Clinic copays, full-blown EAP built into the pricing, telemedicine, and then everyone on the line, we have flexible commissions as well. You can bring it all the way down to 0 if you do a fee, or you can bring it as high as $99. So we do see that $30 is increasing to $35 or $40. That's very common these days. How to quote Aetna? At the end of the day, Ohio is a very, typically a lot of you guys are doing it today, but FormFire, Easy App, that is by far the best way to get rates. It's required below 50 in the 51 and 99 segment by exception, because if you work through Cornerstone, by exception, I'm able to get with their help a GRX exception with the renewal. I think a great statement when you're asking or when you're telling your clients, why do we have to do FormFire? There is almost a 15% best case scenario difference between a GRX and FormFire or Easy Apps. In that 2 to 9 space, we also will even accept paper apps. So, once again, we don't require FormFire. You can do Easy App, paper apps. We just want the medical information so we can price that group appropriately for them to get a surplus. If they currently are level funded or self-funded, we are going to want the claims experience, which is available. Very in line with the rest of the market. For 12/1 and 1/1, we are already quoting 1/1. Believe it or not, the fourth quarter is upon us. I was just talking to Shelly earlier today. It feels like we've been in busy season for 3-4 months already. Just a great incentive. I think this is, these are the things that typically don't make the spreadsheet, right? The chamber fees, the monthly fees to go into some products. Well, we don't have those, and we're actually giving them an admin credit through December 1st. So if it's a 20 enrolled case, they're going to get $2,000 off their second month bill. Along with this is, please, if we are close, work with Cornerstone on seeing if we can, come back and do anything else. I'm sure everyone's recognized and aware that, everyone's hungry for business right now. COVID threw a wrench it was a great retention year, I guess is a good way to put it. But if we're close on a case, engage Cornerstone, engage Aetna, we might be able to get some additional concession or even more premium credits to make the case more apt to move. So one of the things I've mentioned is with Aetna Funding Advantage, you can have up to 4 different plan designs for a 5 enrolled group, right? So, you have a 20 enrolled group, a 25 enrolled group, and they currently have a dual option. Aetna has some of the most unique plan designs that we created for savings. But this plan design right here, it's called Integrated RX. I kid you not, we probably sell this thing 30 to 40% of the time. The price point on it's phenomenal. And there's two really great ways that this plan makes sense for the customer. I'll start out with the first example. How many groups do you have that are offering a single option or dual option with two HSA plans? Either hourly employees, manufacturing, whatever it may be. If the employer is not putting money into that tax benefit, if they're not contributing to the HSA account, I would be willing to bet there's a pretty good chance there is not 100% of the employees are putting money into that tax benefit. And all an HSA plan really is at its core is a tax benefit with catastrophic coverage. If you have a $5,000 HSA and you have no money saved, that's that's not a really great plan for someone, especially with family coverage where the deductible is 2 times that. So what we do, I'd recommend if they have a single option HSA, dual option it, and walking into the open enrollment meetings and say, hey, raise your hand if you like the HSA account. Great, stay in it. We're still offering it. This plan, which the kicker is it's actually 5 to 8% more affordable than an HSA with the same deductible, coinsurance, and out of pocket. It has unlimited first dollar copays on all PCP, which includes telemedicine as well, all walk-in clinics, $0 out of CVS, urgent care, and generic drugs. Tier 1, preferred or non-preferred generic drugs. When you're thinking, well, what's different from just a traditional copay plan? The specialists in the brand drugs and emergency room are going to go towards your deductible. So essentially, for someone who's not putting money into that HSA account, you're trading something you're not using for copays you will use and be saving 5 to 8% of the monthly premium. It's an absolute home run plan for people in those situations. The other situation, and I'm going to skip ahead 2 slides, or I'll come back to that. Another great situation is if you currently are on a copay plan and a single option $2,000 or $3,000 copay plan, well, I would be willing to bet there is a good % chance or a good portion of your group that's not seeing specialists or taking brand drugs on a monthly basis. It's almost a 15 to 20% savings with the same, a 2,500, 100% PPO plan versus a 2,500, 100% integrated RX plan with the same out of pocket. The only difference is emergency room, brand drugs, and specialists. It's a phenomenal dual option. It makes total sense. It's a great base plan, and we have been writing this with groups that currently don't have coverage for 5 to 6 years now, and it's been really a great solution for those employees. I usually get that the next question is, how is this more affordable than an HSA? Well, it's the 80-20 rule. 80% of all services could have or should have been done at a PCP through telemedicine, a walk-in clinic, an urgent care, or generic meds. It's only 20% of the cost. 80% of the costs are going to be at your inpatient, your outpatient, your emergency room through brand drugs, specialty meds, or specialists. So I think that's a great plan to think about, at least adding as a dual or triple option, especially when people, everyone's, very price sensitive now more than ever. Another unique plan design we have, it's called the AFA Essentials. So on the proposals in Cornerstone, they are as fluent at reading our proposals as anyone. They're going to be able to point these out to you, but there's going to be essentials in all the names. It's just another plan design for savings. And what we've did is it's copays for everything, but we've shifted the lower cost services copays, right? So the PCP, instead of 30 or 45, now it's 10 or 15 or 25. Specialist increase from 60 to 75 or 100. Emergency room, that is going to be towards your deductible. The generic meds went down, the preferred meds went up. But one of the major differences that sounds a lot more like an issue than it really is there's no out-of-network benefits. But in Ohio, 98% of claims are in network, and the networks are the exact same. So the only major difference is Alaska and Hawaii. This is the Essentials network. This is the standard national network that's with all the other plans. And here's a great slide to really represent the savings, right? So you have a 2,500 PPO plan with copays for everything. An HSA, well, that'd be a great dual option, 6% savings. The Essentials plan, where we change the co-insurance, that's 12% savings with copays for the specialty meds, brand drugs, everything the same. But the integrated RX plan that I tell you, we sell 30 to 40% of the time. Just look at the savings from the HSA and the traditional copay plan, where there is a lot of employees that fall into the bucket of they want a 13% lower plan, where if you do take a brand drug, or if you see that one or two specialists a year, you pay for it when you have the service, where it goes towards your deductible, opposed to paying for it up front just in case you use it. And then lastly, once again, with the HSA account, just a phenomenal plan here. If you're not putting money into the tax benefit, why would you not save 5 to 8% and get copays instead of that tax benefit you're not using today? Phenomenal plan. Another great benefit is if anyone's been selling ASA for at least 18 months, 2 years, we used to have a benefit called Maintenance Choice. Phenomenal program where they can get 90 days of medication for the price of 60 days. Pretty much every other carrier, to my knowledge, you have to do mail order. Well, with us, with our CVS relationship, you can do mail order, or you can go to any CVS or Target and get that 90-day supply for the price of 60. A great benefit now is we don't require that. So we mandated that 12, 15 months ago, and some people, some members, you guys know how it is. It's always the business owner's spouse, right? They love picking up their 30-day medication at Kroger 12 times a year and paying 33% more. That's fine. All they're going to have to do is call the number on the back of their ID card, say, I opt out of Maintenance Choice, and there you go. Another interesting fact about pharmacy, right? So Aetna, before we were under the CVS umbrella, we had $8 billion of pharmaceutical purchases a year through manufacturers. $8 billion. Very large. Well, now that we're under the same umbrella as CVS and Caremark, that is $145 billion a year. We are, if not the largest, one of the largest purchasers of pharmaceuticals, not only in the country, but in the world. And because of that, our manufacturing discounts have improved greatly from when we were just Aetna standalone. Think it's also pretty interesting. We are becoming the carrier behind carriers. I'm sure everyone knows that MMO rents one of the Aetna networks outside of Ohio. Anthem's Ingenio, that's a CVS formulary, right? So we are becoming, that carrier behind the carrier. But as anyone could imagine, you get better discounts by going to the source. Now I just want to go on and talk about some of the value add. So this is the wellness programs, the member value add that they get for being an ASA member. Probably one of the neatest ones is Attain by Aetna. Attain is a Apple wellness program that they have an exclusive partnership with Aetna. So Apple and Aetna partnered probably 3 or 4 years at this point, and we've created this really great program. So this is offered to anyone on the plan above 18, so dependents, spouses, of course, employees above 18. And what they do is if they're enrolled about 15 days after their effective date, they're going to be able to download the Attain app in the App Store. And the first, you put in your first name, last name, create an account, you put in your member ID. And the first question it asks you is, do you have an Apple Watch, or get a new Apple Watch, or use your own Apple Watch? Well, what that means is anyone who's an Aetna member can get an Apple Watch up front at no cost. You're going to put in your credit card, and you're going to pay for taxes and shipping, which is, I believe, about $19, and we send it to your house at no cost up front. When you put the Apple Watch on your wrist, it's going to sync with your phone, and you're going to get a daily activity goal based off of your age, weight, and height. And so this example right here, the daily activity goal is 500 calories, and they have to achieve it 3 of 4 days, or 4 of the 7 days that week. 500 calories is just about going on 1 3-mile walk. Very, very achievable goal. Well, in the top right-hand corner here, if you see, it says they owe $2. Well, each month or each time you meet your goal for the day, for the week, you're going to be getting points that are actually paying down your Apple Watch each month. The worst case scenario is if you buy the Apple Watch, you put it in a drawer, you never put it on your wrist, you do nothing. You're going to be charged about $8 a month if you just throw it in the drawer and do absolutely nothing. You're also going to be getting points for healthy actions and, key health moments, and I'll get into that in a second. Probably one of the neatest parts of this program is it's integrated with the claims wire, and I'll go over that here shortly. But going back here, if you say, I want to use your own Apple Watch, well, instead in the top right-hand corner, it says you owe, you're just going to be collecting points that can go to gift cards, Starbucks, CVS, Amazon, Dick's Sporting Goods. You can get up to $8 to $12 a month in gift cards with this program. So it's a very immediate gratification, very achievable, and everyone above the age of 18 can take part in the program. This is what I think is the neatest part. Like I said, it's integrated with the claims wire. 6 times more likely to register for teledoc, 20% more likely to get a flu shot, 21% more likely to get that annual wellness exam. And then a lot of these other, if you're 49 and a half turning 50, well, you might get a notification on your phone, or we'll use the annual wellness exam as an example. Well, like I said, it's integrated with the claims wire. We would know if you've identified Dr. Smith as your primary care physician, and if it's August and you haven't seen him as of this year, you're going to get a notification on your phone that says 5,000 points to get your annual wellness exam, and it'll say, click this number to call Dr. Smith. Right, 21% more likely to get that annual exam. So what we're doing is motivating them with points, gift cards, paying off an Apple Watch, giving it to them up front at no cost for good behaviors. Phenomenal program, but that's really just the start of it. Next, we have a program, and this is all built into the pricing. It's always included, and this is the stuff that never makes the spreadsheet. And I'm just going to take a second to just remind everyone that we're almost always competing with a fully insured product where you get an ID card, right? All this other stuff is really just a cherry on top. So the PeerFit, so what this is it's another wellness program. This is going to be for Android or Apple. Of course, the Attain program is only going to be for Apple products. And how it works is each Aetna employee, so it's going to be who's enrolled on the plan, is going to get 40 credits a month. Here's a great picture of the market. So there's 83 boutique gyms in Cincinnati. We're talking Orange Theory, Body Alive, Hot Yoga, rock climbing, boxing, CrossFit. The great example would be Body Alive, right? They're 4 credit hours. 4 credits, you're given 40 a month. That means Aetna is going to pay for 10 of your Body Alive workout classes a month for just being enrolled in the plan. Some of these prices of these classes are $30, $40. So we're saying if you take advantage of this alone, not only do you get an Apple Watch at no cost where you're going to, crush your goal, but you're also going to get almost $400 of wellness classes a month just by being an Aetna member here. You can see 16 gyms here in Dayton area, 70 in Columbus. You got 51 in the Cleveland, 24 a little bit more south there. But what also is really neat about it is if you go or belong to a gym that's not part of the program, you can just go to peerfit.com, nominate gym. We immediately reach out to the gym membership or the gym and say, hey, would you like us to funnel new customers to your gym and we'll pay for their class? Usually a pretty easy sell. And we're seeing that them not only approve or be accepted into the network of PeerFit, but it only takes about 4 to 6 weeks. So another great program with COVID, as everyone can imagine, there's a lot of these gyms are either not having in-person classes or not having any classes at all right now. Well, we also have the 2 largest workout at home programs that you can purchase for 4 credits a month, right? So one of the greatest ones is Burn Along. they have thousands of workout classes at home, similar to the P90X or yoga, or just unlimited resources for workout classes that you typically would be paying for, once again, for just being an Aetna member. Moving forward, a full-blown EAP program built into the pricing. Full-blown EAP. You get 3 face-to-face visits a year at no cost. Right now, the child care and the elder care has been huge. Phenomenal resource. This is the number that they call. They don't even ask what their member ID or anything. We just ask how we can help. Behavioral mental health, like I said, you get those three visits a year at no cost up front. Just really a phenomenal program that we just put in there at no cost because we think it's important for our members to have resources when they need them. I think this is probably the neatest, one of the neatest programs that we do offer, just telemedicine, right? But what we have that I believe, once again, is first to the market is dermatology and behavioral health. So this is the HSA pricing, right? So this is the HSA pricing here, whatever. If you had a specialist copay, that would be the price. Dermatology is great, but the behavioral health is huge. So it's psychiatrists, psychologists, clinical social workers, counselors, therapists, and how it works is you log on and it's going to ask you 6 questions. And based off of your 6 answers, it's going to make a recommendation on, do you need to talk to a psychiatrist who can prescribe medications, right? So you can actually prescribe medications through this, or would a therapist or a counselor make more sense because it's a lower cost? Just once again, especially with COVID, a phenomenal resource that's always available. To continue, any CVS Minute Clinic in the country, if your employees are on a integrated RX, an Essentials, or just a traditional copay plan, they can go to the CVS Minute Clinic at a $0 copay, unlimited throughout the year. Dayton, I think they have 7, Columbus, 12, Cleveland, almost 24 of these Minute Clinics. We're between telemedicine, the EAP, this Minute Clinic here, we have a lot of no or low cost places to receive care that's unique to being an Aetna member. If they're on an HSA, it's going to be a reduced price, but of course it can't be a $0 copay until they've met their deductible. And it continues, 20% off on all health brand goods in store of a CVS. So this is pain relievers, baby products, allergy, cold and cough remedies, heartburn, stomach remedies, vitamins, first aid. Just for being an Aetna member, if you go to the Aetna portal, where your Aetna website, you plug in your member ID, we're going to connect your extra care card, recognizing you're an Aetna member, and you just get 20% off of all of those in store, and an additional 2% back on your extra bucks rewards. Just another great benefit. A pretty neat statistic is nationally, 95 or 85% of the country is within 5 miles of a CVS. In Ohio, that number is 90%. 80% of Ohio is within 3 miles of a CVS. So you have a 4 and 5 shot at being within walking distance of one of these stores, and you have some pretty great benefits there. We have a phenomenal and very lucrative bonus program that seems to just be getting better every year. We have a new business and a retention credit here. So it's not, most carriers have them relying on each other. We don't. If you can sell 5 new cases, and once again in Ohio, this product goes down to 2 enrolled, 5 new cases or 75 subscribers, whatever comes first, you're going to get $75 per enrolled just as a bonus. This is also 2 enrolled to 99 eligible. I've had a lot of brokers just, max out on this bronze by selling 1 51 to 99 case. Silver, 15 new cases or 200 subscribers. Could be 3 cases, could be, 3 51 to 99 cases. You're automatically getting $200 or $100 per enrolled. And then gold, you can see that maxing out at the $150 per subscriber. The retention credit, 75% to 79%, you get $20 per subscriber on your book of business. 80 to 84, you get $40. 85% or more, you get $60. In my experience, I think that's a pretty favorable retention, 75% retention. That means a quarter of the cases leave and you're still getting a bonus for that. Before I go over the reporting in more detail, I'd just like to sum this up with one more. Compared to the fully insured products or the MIWAs nationally, with 42% of groups are getting money back. The reporting I'm going to go through, I think you're going to see that the transparency with this product is above just about everyone out there. Of the 4 different plan designs, we have unique plan designs that bring savings, but also a strategy that really meets the member for what they need. No chamber, no monthly fees. They get an Apple Watch at no cost up front. They get 10 free workout classes that could be up to $400 a month in workout classes. 20% off all those brand goods in stores, $0 MinuteClinic copays, EAP, just built in to the pricing, and then you have that teledoc that includes dermatology and behavioral health. Like I said, the commission's flexible. So this is a report that you can pull for any case over 10 enrolled. Once you get 20 enrolled, you're going to get all this information. With 10 enrolled, you're going to get all of the executive summaries and most of the information. But how it works is it's always prior year compared to current year, percentage change compared to Aetna BOB, Aetna book of business. So just for one, this report you're going to find out can do 2 things for you. One, you can be consultative, right? We can figure out which plan design makes sense. But 2, you have something to talk about throughout the year, and then also during that renewal. I mean, there is no guessing. There is no the carrier's running hot or they're just trying to get over on you. It's 100% transparency. So right here, you just have financial information, and I highlighted a couple of the great numbers here. You get your total broken down, total claims by pharmacy, by medical, inpatient, outpatient days, prior, current percentage change, total utilization. You get how many admissions, acute days, non-acute days, total days of care, average length of stay, total surgeries. You get emergency room visits. One thing I like to mention is this is all standardized. So it's not 101 emergency room visits. It'd be 101 divided by 1,000 times the amount of members in the group, right? That's how we can compare it to this book of business. Medical cost share. You get the impact of the medical catastrophic claimants over 15,000. So what does this, last year they had 2 large claimants. This year they have 4. The total amount increased from 50,000 to 129,000. 49.8% of total claims are these 4 members. You have a real conversation about what's going on in your group. And it's much more than that. You get a total pharmacy broken down by generic, brand single source, and brand multi-source. Once again, a 20 enrolled group has all of this information. You get your, how much, if that generic utilization is 95%, why would you not at least put a dual option of that integrated RX plan where all generic drugs are a copay and brand drugs are towards your deductible, right? So you get your brand single source and your brand multi-source utilization and dollar amounts. You get just an overview, executive summary of the pharmacy with how many number of claims, total copays amount, generic utilization, formulary utilization. This page alone does not exist in the below 50 world, right? If you're talking about a MIWA, good luck with this, right? They'll say you have a large claimant, and we're expecting a lot of ongoing claims. Well, here we show you got the total medical pharmacy broken down by inpatient, outpatient. You get a diagnostic category, a description, and was it rendered last quarter or is it ongoing, right? Total broken down medical enrollment. Okay, so for that plan design that has no out-of-network benefits, at renewal, you can see that 100% of your admissions and claims were in-network. Well, why would you not want to look at least saving 9 to 12% by dual optioning or putting a triple option with the plan with no out-of-network benefits? The next 3 pages, once again, for 20 enrolled plus. I mean, you don't find these pages in a group that's paying $1 million a year at 99 enrolled, right? Because it's not over that 100 thresh point. Your top 25 pharmacy meds, broken down by how many utilizing members, number of claims, percent of all claims, paid amounts, 100% of the medical utilization. With these 2 reports, I can tell you every single dollar, what it was spent on in the pharmacy world and in the medical world. the inpatient, outpatient, emergency room, specialist surgery, radiology, mental health, medical pharmacy, compared to prior, compared to current, percent change. And then finally, probably the most descriptive page is your top 25 major diagnostic categories. How many admission days, with what description, how many admissions, how many days, with inpatient, outpatient paid amounts, total paid amounts. There is the days of hiding behind the fully insured. We can't tell you anything. This product is 2 enrolled and 99 eligible. This is why we lead with it. This is why we won't quote fully insured unless they're a non-ERISA group, which would be churches or municipalities. It's why would you not want reporting, not get a chance of surplus when the pricing, even if it's the same, right? So that is Aetna Funding Advantage. And just, one last biggest difference: surplus, plan design, transparency, more member value adds than any other carrier out there. And this is all, the product does not change from 2 enrolled to 99 eligible. It's a great solution in Ohio. We are one of the nation's we are leading in the nation. This product's been around for 5 years. Cornerstone is a top 5 GA for AFA in the country. So if something goes wrong with Cornerstone by your side, most of the time we're going to be able to make an exception and fix it for you. Great solution, great product, and I'd love to answer any questions if there are any at this time.
Scott, can you hear me?
Sure can.
So there are a few questions. I'm not sure if Nelson is still on the line, but do you think that you'll be expanding into California eventually as well?
So we would love to.
Do you get updates on anything like that?
New York and California, those are the 2 states where ACA or community rating goes up to 100. Which, we would love to go into California. It's one of our strongest 100+ markets. But at this time, until something changes with their DOI, we can't. But if that ever changes, that'd be our first market that we'd jump into.
Okay, thank you. And do the discounts for admin apply to new business, or can those be received by a group renewing?
That's a great question. So the $100 per enrolled credit, that would be this one right here. This is going to be for new business through 12/1. But what I would just, if you have a case that you think needs a little bit more, always go back to Cornerstone or the account manager. We love to keep the good cases, but this is a new business credit.
Okay. I'm not sure if we covered the discount question as it relates to Attain. That is open to any members at any time once they make that initial purchase of the watch. Is that a correct statement?
Rephrase that question.
As far as the discounting on the Apple Watch. So on the Apple Watch, the available is a person could purchase that maybe say in the 2nd year of your program after their group is renewed. It's not required in the 1st year.
You got it. Yeah, there's no time limit on the program. If you have a group that's been with Aetna for 3 years and you think that they'd be interested and they haven't done that yet, absolutely. We'd love to have them. There's no time limit for enrolling in any of the wellness programs or value adds available to any member.
Okay, and could you also just quickly review the employer premium contribution requirement and participation?
Yeah, thanks for that, Shelley. So it's 50% of the single rate, or the most affordable plan, 50% of the single rate, and 50% of total eligible is going to be the across the board the participation. We don't look at valid waivers, but one thing that's really unique with Aetna Funding Advantage is because it's technically self-funded on level funded paper, right? We can, on the employer application, you are able to increase the total benefit eligible hours up to 40. So a great example would be if you have a fast food restaurant. A lot of them, participation is always really difficult to get over. Well, if 30, you look at it, and anyone that works over 35 hours a week is a manager who's typically taking the coverage. On the employer application, you're able to increase that eligible hours up to 40, down to 25, once again, because it's on self-funded paper and they don't have to abide by that 30-hour restriction.
Okay, and can you also comment on the frequency of the reporting and when those would be available to that 20-plus customer, both ongoing and then at renewal?
Absolutely. So that was one of the reports. That is the most detailed report. We also have a monthly report that looks very similar to our other competitor level funded carriers, where you're going to be able to see if you're tracking for a surplus, right? You're going to be able to see how much you have in the bucket, how much total claims has been, and kind of see if you're at a deficit or a surplus. That's sent monthly. This report, the AHIA report, you can pull this at any time yourself or work with the account manager if you don't have access at this time. All we would recommend is that you wait at least 6 months, because you want this information to mean something. If you pull it in March and you only have January's claims, and you had a really bad month or one large claim, it might scare the client. But other than that, I mean, this is a report you can pull at any time with yourself or through the account manager.
Yes, your broker advisor at Cornerstone can always walk you through those steps as well, if you can't figure that out. So please reach out to them. We will be getting a copy of the slides to everyone following our presentation, so that has come up frequently. When will 1/1 quoting dates be available? Do you have an idea on that?
We're already on it. Yeah, we're 120 days out. We are quoting 1/1. Can't believe it.
Okay.
But yes, we are live.
And perfect. And any major plan changes at all that you're anticipating for 2021 other than the news you shared with Cleveland?
No. So what's great about I think it's great. We do all of our changes for 9/1. So everything, we don't do changes for at 1/1. So what you have now, the quotes you have now, those are going to be the same throughout the year, throughout the busy season. What we did do is we added a bunch of leaner plans on the proposals. So if there's any brokers out there that really like that HRA strategy, we have, I would imagine, the leanest plans out there that you can really get creative if you are someone that really likes HRAs.
Okay, I think that wraps up the questions that I can see thus far. Scott, we really appreciate your time and information this morning. That was a great update